Hello, and welcome to the Flourish Podcast with Dr. Toni Engram, where you will hear straight from some of the best practitioners and leaders in wellness on how to take control of your family's physical, spiritual, and mental health, because we were all designed to flourish. As a reminder, this show is for educational and entertainment purposes only. Nothing said on the Flourish Podcast should be taken as medical advice. For your own specific medical advice, please always consult with your own healthcare providers. All right, guys, we are so pleased to welcome Dr. Sharon Dickerson today. Dr. Dickerson is a trauma-informed biological dentist with over 35 years of experience, dedicated to transforming not only her patients' dental health, but also their overall sense of well-being. Her journey into holistic care was born from a personal health crisis early in her career when mercury toxicity from her profession led her to reimagine how dentistry could truly serve and heal. Dr. Dickerson's approach is rooted in meeting people human to human, offering a level of compassion and loving care that is increasingly rare in medicine. She believes that trust and connection are the foundation of every transformation, empowering patients to reclaim their health with confidence and hope. Dr. Dickerson, welcome. I am so glad that you're here with us today.
Thanks, Dr. Engram. I'm so glad to meet you today and give this chance to have a conversation about our mutual profession.
Absolutely. And this is a rare treat for me. I don't always get to chat with other dentists.
Same here.
Sometimes we're a little shy. So I'm thrilled to be able to talk with you. I've been seeing some of your content online for a long time. And so this is a really great excuse to meet a new friend.
Awesome. That's great.
So tell the audience first, I would love to know sort of how you became a biological dentist. What caused you to make that shift? What was that health issue for you, like you talked about in your bio? When was that and what happened?
Yeah. So I was a couple years out of dental school, but just as a backdrop, I had grown up with my father as a dentist. And so I started working in the office, playing around in the office as a youngster. So the exposure to toxicity due to mercury was there probably from childhood. But when I went to dental school, there was certainly no thought about protecting the healthcare workers, the dentists, the assistants related to mercury that's in dental amalgams. So we were all a little bit clueless, although it's crazy because besides that, we were also learning about Mad Hatter's disease. Did you guys learn about that?
Not in dental school, no.
Well, I can't remember if that was dental school or if that was in undergrad, but mercury toxicity in humans is not a new concept. We've known that it's been a problem for centuries now. So anyway, long story short about my health was that I started to develop what was termed fibromyalgia or chronic fatigue syndrome when I was a young mom, young dentist in my early 30s, and was really struggling for somebody at that time to be able to help me discern what was going on. You know, you rule out very basic things pretty quickly with the traditional medical model. But I did find a medical practice in Grand Rapids, Michigan, near where I was living at the time. And they did some testing with different things like food allergies. And the primary thing that it turned out was causing a lot of my issues was heavy metal toxicity, especially mercury poisoning.
Wow.
So I was just feeling really crummy. And, you could pass it off as, well, you're a busy professional. You have 2 young kids. Of course you're fatigued. But I knew it was something more.
So you really had to take it into your own hands and be your own doctor,
right,
to try to get the answers that you needed.
Correct.
What type of practice did you go to? Was this functional medicine at the time, or
it certainly wasn't called that. There's a clinic, actually, they still exist. There's a couple generations now. called the Bourne Clinic in Grand Rapids. And they were, I feel, on the cutting edge of really looking at entire metabolic panels, looking at different influences on the immune system that weren't really being explored routinely at that time. So yeah, they were DOs at the time. There may be MDs and nurse practitioners in the practice now, and then they had methodologies to help detoxify, which is the whole point,
Yeah.
through chelation. At that time, I think chelation was maybe harsher, and we didn't necessarily understand how important it was to clear the metabolic pathways and have great nutritional support and all those other things that help boost the immune system. But that's how I got into it, because once I got feeling better, the big question was, how can I continue to be a dentist and be in this environment and be involved in these toxic materials? And so I started to learn how to deal with mercury, especially safely. And then that leads you into getting to know dentists who are tapped into all different ways that the dental materials and dental environment can impact systemic health.
Yeah, absolutely. And so did you join the organizations, or did you figure this out on your own?
Yeah, at that time I was able to learn from the IAOMT, and they're kind of the gateway for a lot of us that try to get into this. And then, it just kind of expanded from there to various organizations and lots of different trainings and teachings. And
I love it.
Mm-hmm.
So mercury was the first thing that really hit home. At this time, what is your dad still alive? What is your dad saying during all of this?
Yeah, well, it's interesting because he was always a very holistically minded practitioner. He was called the holistic dentist in our small town in the 1970s.
No way.
So I don't know what that really meant back then, other than he always just had a very expansive view of people's health, his patients' health, their well-being on an emotional and spiritual level. He knew his patients very well. So he was very much in favor of anything that could help all of us stay healthy.
Wow. What a blessing.
Yeah, it really was.
What a blessing.
We had a lot of conversations that at the time they're almost whispered in the back room because it seems a little crazy, but he was somebody I could talk to about all that kind of thing, and keep an open mind, and be willing to look at new research, new information, even if it hasn't hit the mainstream yet.
Yeah. Yeah. Wow. What a trailblazer.
Yeah.
And so awesome that you had that support. Because I know it took me a long time once I started learning about these things.
Yeah.
I was taught in dental school that don't listen to those people who want to take out the amalgam fillings. Those people are crazy.
Exactly.
And so there was a lot of mental turmoil
I know
that I had when I started to believe the studies that I was seeing.
Right.
And, look into the actual science. There was a lot of hesitation. And I think there's still some hesitation.
For sure.
I think the tide is shifting with millennials who are, as they're coming into practice, they have a more holistic view. I think it's more acceptable now.
I hope so.
That was definitely not the case.
Right. But all you need to do is meet a couple good mentors or professional people who've had their own health crisis and were able to reverse it by dealing with this directly and detoxifying, to realize, okay, even if it doesn't affect everybody, it can affect certain people really in a very negative way for their overall health.
Absolutely. So typically for biological dentists, as we kind of get into down the rabbit holes,
right?
Mercury and fluoride kind of go hand in hand. So what were your thoughts on fluoride? Have those shifted over the years? And where are you landing right now?
It's so interesting because when I first started to, I don't know what you call it, have an awakening that maybe there's more to the story than what I had been taught in dental school and in the journals at the time. Like I said, the mercury toxicity and that potential was one of the first things. But at the time, I remember having a patient that lived in rural Michigan. I don't live in Michigan anymore, but I practiced most of my career there. That was kind of an alternative health-minded person. He had a couple kids, and he was very adamant about fluoride and the toxicity of it. And at the time, I thought, I don't think there's any validity to that. I started to realize, okay, there's people out there with very different beliefs and different influences. So the fluoride took a little longer to come around, but once I started seeing, especially with the IAOMT, their position paper on it, and really looking into the research on it, I realized that the risk benefit really didn't seem in favor of having it so overloaded in our municipal water supply and in all these oral hygiene products that a lot of people were getting too much. Yeah. And in fact, it hit home with one of my kids because I was so big on fluoride. When they were little babies, I'm like, if a little's good, a lot's better. So at the time we were using the drops because we had well water, blah, blah, blah. Well, one of my daughters ended up with fluorosis. That was pretty unsightly markings on her teeth. And that led us down a whole track of doing veneers that ended up having, causing problems with her bite and her occlusion, and causing her to need a root canal at a young age. And that was part of a whole complex of immune trashing things that happened to her as a late teenager. So, like I say, if you have an open mind and you start having experiences or people around you with experiences, you start to learn, okay, there is sometimes, if you go behind the veil, there's going to be more to the story. And it warrants keeping an open mind, I think.
Yeah, for sure. Gosh, I feel like we could talk for another 30 minutes just on
I know.
your daughter's experience. And the thing, was this your oldest kid by any chance?
It was, yep.
I was going to say, this sounds like the typical oldest child experimentation by parents.
Right, exactly. Yeah. And
we're trying, y'all.
We
oldest kids trying. Out there. We try.
And I didn't understand the risk related to extraction of the wisdom teeth at that time. I didn't understand the risks that she undertook, which ended up being pretty disastrous with the Gardasil vaccine. And so she just kind of got hit with 3 or 4 different things that really, really compromised her health. She's still climbing out of it, probably 13 years later.
Wow. The things we learn.
Right.
And I think it's so interesting too, that one thing that I think in integrative and biological medicine, in functional medicine, I think it's so important. And I hope that we do this slightly better than our colleagues, but it depends on the day. We don't always do this.
Right.
I think just maintaining a level of humility on the amount of knowledge that we have and the amount of knowledge that we don't have.
Yes.
Keeping that humility as healthcare providers, that we are clearly not the ones with the answers, that we're all learning how to live on this planet, and that thankfully God's in control and not me. And we're just doing the best we can with what we have.
And there's no way, especially with the amount of access everybody has to information now, we can't know it all.
Right.
You can't know it all.
No.
So then, yes, you learn from patients that come in. And I saw something that you created content-wise related to the concern with graphene oxide in dental anesthetics. And, that was brought to my attention by patients.
Yes.
Different issues like that gentleman that I mentioned from 30 plus years ago in rural Michigan, that I think was, in retrospect, ahead of the curve on the fluoride issue.
Absolutely.
And at the time, I didn't really know how to help that person because I didn't know what they were even talking about. And I don't know where you'd even find that information at that time. There was no internet. You'd have to go to the archives of research in big libraries and That's probably what he was doing. So yeah, the current era is so much different with the information at everybody's fingertips. And then you have to be discerning and sort through what's valid and what's hearsay and
Oh yeah,
what's
now it's a whole
anecdotal
other
and what's
host of
scientific.
problems.
Mm-hmm.
So, what are your thoughts now in the RFK Jr.
Yeah.
Maha era? What are your thoughts on where we're heading as a nation with fluoride? Do you think the tide is really shifting, or do you think it's more hype and it's going to kind of slide back?
I think once it's sort of like once your mind has been open, you can never close it back on a certain topic. I do think there's a realization that the fluoride issue needs to be legitimately postured as something we have to look at. There's just so much more evidence mounting that that it can really affect childhood development, IQ development, can affect thyroid function in older adults, and a host of things. And I don't think that information's new, but to get it out into the general public with the powers that be it is a whole nother layer of champions. And an RFK, is willing to put himself out there as somebody who wants to bring this to light, help impact change. And I don't know how else you do it in a culture like ours.
Yeah.
Some people have to be out on the front lines, at least waving the flag and saying, hey, we need to look at this.
Yeah.
And at least make it okay for people to ask the questions and investigate and make decisions for their own communities with their water supply. Was it the whole state of Utah that just banned fluoride? So they're on the cutting edge of a different way of looking at it.
Absolutely.
That different states might make a different decision, but at least needs to be a topic that can be discussed.
Yes, and discussed with openness,
right?
And
exactly.
Not a bunch of local dentists shutting everything down,
right?
Shutting down the discussion,
yes,
and poo-pooing it when there actually is good evidence now that it is more risky than we once thought.
Yep. Exactly.
So you talk about, so we know your history with mercury, your history with your own child and her dental trauma. I know that you consider yourself a trauma-informed dentist. Tell me a little bit about what that means and how that started.
If you think about dentistry from a standpoint of vulnerability for the patient, there's nothing that compares, in my opinion.
Yeah.
There's no other realm of medicine where we're asked to be in a fully conscious state, open up a very highly sensitive part of our body and lie still and give complete consent to oftentimes a total stranger to literally enter our body, which is happening when we go into the mouth, and you're lying back. You need to keep super still. This is about as vulnerable as it gets. I mean, that's my opinion. And that's what I've had a sense of from the very beginning of my career. So then when you add to that somebody who may come in with a history of any kind of trauma that they've experienced, but especially physical trauma, sexual trauma, dental trauma, it can really be debilitating in terms of the amount of anxiety that people can experience. And many times they can't even identify it. They don't exactly know why they avoid the dentist so terribly. So why they just put it off, and why when they get there, they're almost debilitated by anxiety. So in the past, you can use medication. I certainly had access to things in dental school to help people deal with getting the dental work done, even though they had all this anxiety. But what I prefer now, as I've worked with different ways of being with people, is to just start the relationship in a different way. And I spend a good 30 to 40 minutes with every patient in a non-clinical setting before we even go near their body, besides a quick handshake and greeting. And just walk through what's their history, what made them pick up the phone and come in, what has happened to them, good, bad, or otherwise, related to their dental health or their overall health. We dive quite deeply into their systemic health. Who are their providers? Do they have a team of good functional medicine practitioners or not? Is that something they even need? So as people start to unfold why they're here, what brought them in, they have start to develop a relationship, a verbal exchange. Then I start asking about their dental history, and it may or may not come out specifically, but they'll start to be able to feel safe expressing their level of anxiety. And from there, I found that it just really requires building trust, being sure to offer choices and give the patient control over all those choices with each step. So from a non-clinical consultative type of environment to the clinical area is the first area of consent that I'm going to be, I don't make a big deal of it, but like, it's a worthy question.
Yeah.
We've talked this all through. Is it okay with you if we move into the clinical area now? Here's what we'll do there. And I don't think it's very often that somebody would say no, but I've had it happen before where it's like, I think I've done enough for today. I'm exhausted from just having this discussion. Could we step into this, at another time?
Yeah.
I think acknowledging how they're feeling, if they can come forth with knowing that they've had a traumatic experience, if they want to express it. I learn a lot, maybe about what got them where they are with how they're feeling. But then it's really to encourage them to be able to feel empowered from there on, that they have control over the next step and the next step. And usually then by the time we get to the point of prescribing some treatment, there might be, there's a whole nother set of things to navigate it in the course of treatment. But usually by then they're like, wow, this is the most comfortable I've felt. Most people want to take care of problems with their health. There's usually time, money, fear that keeps people from progressing. So if they get to the point where it's like, all right, this is my best shot, I want to keep moving forward. And then we can really talk about how to help them manage their anxiety in the moment of treatment. But to me, there's a whole host of steps up to that point that make all the difference.
I love that. And you're doing that. So you're doing that non-clinical, basically a consult in a consult room. And that's you before they even interact with the team.
I mean, they get greeted by the team. They get, offered gratuities as far as, made comfortable and all that stuff. But yes, definitely I'm the first point of contact just because that's my passion and that's what I would want. I remember I went to the dermatologist. I found a new dermatologist. And when I went in, as soon as I just barely got into some cold room and they're like, here's this paper gown, please undress completely and put this on.
Yeah.
And I was like, wait, I don't even know this doctor. I don't even know if I want them around me. Like I was being a grown up about it, but I did ask, hey, would it be possible to just at least get to know the doctor before I disrobe and put on a paper gown? So I probably have just my own bias about how I would like to be met as a patient and how I feel like I would want to help a patient feel comfortable, because I don't want anybody to ever feel, because I have so many patients come in and they'll say, the doctor told me I needed this, I needed that. I had to just schedule, get in there, open my mouth, do it. They gave me shots, blah, blah, blah. It sounds like another layer of trauma to me.
Right.
In some cases.
Yeah.
Of course, not every patient has that level of anxiety, but for some that do, it can really keep them from getting the care they need. And it can cause disastrous effects to their health. With untreated oral infections and all kinds of different things.
So how do you feel like that impacts their anxiety during treatment when it is time
Right.
to get some of the dental work taken care of? What do your typical treatment appointments look like?
I'm scheduling longer time, I know, than what other dentists might schedule. We're often prescribing treatment that's going to be done at least in quadrants, or that has a plan for a comprehensive addressing of soft tissue health, dental health, any bite issues, so that we can see where we're heading with this.
Mm-hmm.
So the person is engaged in a long-term prospect and an end goal of health, stability, comfort in their mouth.
Mm-hmm.
So then when we start with day one, they know, okay, this is the beginning of a journey. And so we start to learn together how to help them be more comfortable. And as a practicing dentist, I'm sure you know, so many people have different quirks and different triggers in the chair of what's the worst part for them. For some people, it's the initial injection. For other people, it's the sound of the drill. For other people, it can go on and on and on. But once we start working with somebody and give opening for a conversation and for them to express what's happening in the moment, then I'm also encouraging them to, we're building trust. And as a sense that I'm not going to clumsily come with big instruments in their mouth and just grind away and hack away. It's a very unassuming, gentle approach so that people can see, all right, start to feel like they're going to be safe here.
Yeah.
Safe emotionally, safe physically. I don't know about you, but I'm astounded. There's still people that come in and they feel like they got beaten up by past dental care.
Yeah.
And it was either rough or just not acknowledging them as a person, not acknowledging their feelings. And then if they have a couple of those in a row, they start thinking, I'm never going to be able to move forward with this and try to get a healthy mouth. So then what I love is once somebody realizes, okay, this is going to be okay. Yeah, there's a little discomfort. We can combat it with different comfort tools, headphones and blankets. And I love the massage and vibration and heat part of my dental chairs. That's often kind of a little distraction, just all kinds of creature comforts that we can offer. But then honestly, they come to the point where they have to hold open and let me do my thing. And when then they get through that and the dentistry feels good, it looks good, they got through it, then we can start building on that for them. And what's so gratifying, as I'm sure you've experienced, is when you get to the end of a treatment plan, whether it's simple or complex, and they're like, I can't even believe I did it. And I feel so much better. And people really appreciate the ability to get that part of their body healthy.
Absolutely.
And feel safe doing it.
So do you find that you're doing, well, do you do sedation, whether it's oral sedation or IV sedation? Do you have the more traditional pharmaceutical methods of helping patients get through appointments?
I do, but I honestly don't pull those out that much. And I don't think it's a conscious decision on my point. My preference is for us, me and the patient and my team, to all be arm in arm, walking through to a state of trust and comfort. But of course, I don't do IV sedation, but we can use some oral sedation. We certainly have nitrous oxide. Those are tools that can be very helpful to people, especially initially.
Yeah. Oh, I love that. Love it. And what's interesting about what I've read about your practice, and I think the two things go hand in hand, is you do a lot of TMJ care. I'm sure much more than I do. And I find that TMJ dysfunction and anxiety and dental trauma seem to be two peas in a pod, basically. It seems to go together a lot. So tell me a little bit about your TMJ work.
So, that was so interesting as we're talking, because so many of the things you get interested in, as I've gotten interested in, are because of personal experience or certain waves of patients come in with complexes of issues that take you to go learn more and all that. But in my case, I had a whole nother layer of dental history that led to pretty severe TMJ and bite problems. But I was also just always very interested in how the jaw joint and the muscles and the nerves that work the mouth and the joints all work together, and how the bite is intricately intertwined with the health and comfort of the TMJ. So that was another thing my father had given me advice on early in my career, was to go to school and learn everything I could about occlusion. So that's how the bite works along with the rest of the chewing system, because that's where you can start doing more complicated work for people that need restoration of not just a tooth or pulling a tooth or replacing a tooth, or maybe, I don't know, fixing some things within their current bite. But if the whole system needs to be rehabilitated, that's not something, at least, that I learned in dental school.
Mm-mm.
So I did that. I had an opportunity to start taking time away from the practice while he was still in it in the years past, where I went to a lot of the different, continuums of occlusion study. But eventually landed on a really important help for my own occlusion, and then learned through orognathic bioaesthetics a way of stabilizing the jaw relationship through appliance therapy, and then utilizing tools to balance the bite with restorative processes or whatever might be needed, orthodontics, oral surgery. And then once I became into the more biological side, and then as healthcare has progressed, there's so many additional ways to help people impact the TMJ problems and their bite, with craniosacral therapy, physical therapy, acupuncture, nutrition, anti-inflammatory diet. A lot of those things now are part of that whole treatment process.
Love it. Oh, that's so cool. So where did you do some of your, I'm sure you've done a million CE training courses over the years. Where would you say you did the bulk of your continuing education around TMJ and occlusion?
So back in the 1990s, I was blessed to be able to go through the entire pinky continuum. It's still a viable organization teaching dentists great things out there. The Dawson Center was kind of a very similar philosophy, that whole continuum. These things, as you know, these aren't just a weekend seminar. You're immersed for an entire week. You're learning hands-on skills. And then you go home, you try to implement it, then you go back for the second phase. Another week down in that time is Key Biscayne, Florida. I think that's still where Pankey Institute is based. The Las Vegas Institute has a little bit different philosophy, so I've got introduced to all that. But ultimately, it was OBI, Orognathic Bioaesthetics International, that was probably the way that I've learned to approach these things most predictably and most comprehensively. So that's a way of practicing for this type of TMJ and occlusion that I've been into for 20 plus years.
That's amazing. And I don't know, I appreciate the breadth and depth of that. Just to tell the audience, you have no idea all the things that she just listed, how in depth each of those programs are. So little Toni Engram doing the occasional, night guard to help take the pressure off the TMJ. That's nothing compared to what Dr. Dickerson is able to do in her practice and the training that she has and the knowledge that she has. So I hope that people and that patients appreciate that when you get a true TMJ expert, it is so different and so much more in depth and detailed than what your average general dentist can do, even a biological dentist.
Right.
We don't get that type of education around TMJ like that. So that's a huge investment in time, in money, and just, I'm sure, blood, sweat, and tears working to make it all happen and get patients the best outcome.
Well, thanks for saying that. I mean, I think we all have, like we were saying before, you can't know everything. So ultimately, you end up going down paths that interest you the most. So I had a high interest in that. And yes, the training is one thing, but then where you really learn is through patient care.
Yeah.
So that's why this whole way of approaching patients in a holistic way, in a comprehensive way, trauma informed. A lot of times TMJ is its own brand of crazy making for people, and the anxiety
Yes.
can be extremely intense because of the pain cycle related to TMJ, fifth cranial nerve problems. So it kind of all fits together.
Mm-hmm.
And then when you realize, okay, how do you help damp inflammation in general in this person and help their digestive health, which the TMJ and the bite are intricately tied to, that's when it really is, okay, this is a whole person, whole body, whole jaw system, dental approach, which is to me where the real fun and gratification comes in.
Absolutely.
Mm-hmm.
Absolutely. Yeah, when you can see that shift, you can see that transformation in somebody.
Right.
Is
And
really
it happens
incredible.
over time, and people can have ups and downs. And that's where I feel so blessed. That's part of why I moved to Denver, is because there's so many, I guess I'd call it allied healthcare providers in our neighborhood that
Mm-hmm.
can assist. And now there's a whole avenue with the TMJ related to various types of injections, PRP injections and stem cells. And there's so many new ways to help assist this healing process besides just restoring the bite, that it's become kind of a whole new ball game. But to me, it's so
Yeah.
exciting. But sometimes you hit a little bit of a wall with somebody's progress, and that's when you can call in other help. And I'm always asking them, how is your digestive health? How's your digestion? How's your sleep? The whole area of sleep dentistry is also very much a part of that whole intake process
Yeah.
and part of the story. How are they feeling in general? How's their energy level? They're so many of our patients, if they don't already have a good functional medicine provider of some high level site source, we will help connect them, because that's, to me, where they can really get feeling good.
For sure.
Mm-hmm.
For sure. Oh, that's cool. And yeah, I bet in Denver there's just a ton
Yeah.
of integrative functional
Yes.
providers.
And
So are you doing some of that fun PRP stem cell stuff?
I don't do those injections, but I have colleagues in our area that are getting really good at it. So it's pretty
Nice.
cool. And just
Nice.
like I have a physical therapist that I've worked with over many years now, and with different patients, and we've learned together how her specialty with that area of the body can go along with what I'm trying to do. And it just takes some collaboration, some back and forth. I have physicians that are functional medicine MDs that, again, they're going to be off of the insurance networks typically. And patients are going to them because they want a comprehensive approach. But when we can collaborate and help set priorities for a patient related to their levels of toxicity, their digestive health, their immune system health, it can all work together, and really help people get to the best outcomes when you have a team approach like that.
I love that. And you mentioned, an out of network provider.
Mm-hmm.
Um, and I get this a lot. I don't know if you do
Mm-hmm.
too, just hearing the general public where there's such a desire to seek out biological dentistry, functional medicine. There's a
Mm-hmm.
desire for this, but what I hear so often is it's so expensive,
Yes.
or so and so doesn't take my insurance. Are you utilizing insurance in your practice at all, and or how do you handle the insurance question?
So this is another thing that kind of goes back to how I was influenced as a young dentist. And back in Battle Creek, Michigan, my father never participated in a contract with any dental insurance. And he saw the problems that could come from having that third party influencing these treatment decisions very early on.
Mm-hmm.
So I kind of grew up with it, so to speak. But then when I opened my startup practice in Denver about 5 years ago, I really had to make a decision. What level do I want to participate with, even assisting patients to
Yes.
submit their own and various things. And then I did a lot of thought and prayer about it. And I realized at this stage of my career, it's not a topic or an element of energy or anything that I want involved in my day-to-day conversations with my patients. So we're very upfront about that with patients in the beginning. And it truly is to their benefit, ultimately, if they can possibly, make a priority within their family budget to
Right.
not have that be how we make our decisions from me as the dentist to them as the patient. And it's just not in my ethos at all anymore to be thinking, how does this fit with some dental insurance model?
Yeah.
It's really about, let's look at your goals, where you want to go. How is your total health? What are the health priorities related to your dental work? How can we start making progress on this in a logical way? And I can do my best work, take the time I need to have the best materials, help hold their hand through the anxiety phases, allow enough time so that I'm not running around doing 6 hygiene exams in the middle of their appointment, leaving them numb and propped open while I run down the hall and do a whole other procedure.
Mm-hmm.
So it's a different model of practice that isn't probably for everybody. And some patients have to, their budget is such that they have to stay within the limits of whatever their dental insurance will cover. And there's so many good dentists out there that have figured out how to operate under that. It's just something I've decided, it kind of eats away at my soul.
Yes.
To be having to answer to somebody that doesn't even know this patient, that has arbitrary restrictions on what's allowed. And I just decided I can't be handcuffed like that. And there's so many avenues where details matter, that when you're in an insurance-based dental model, you don't have a choice. You've got to be able to make up for the lack of reimbursement by high volume. And that was another formula for me having a crash in my wellness back in my 30s. I was trying to do too much. And then you don't, even as a dentist, I don't like my results when I feel rushed.
Yes.
You never can take as much time as you'd love. We would all sit there and polish this restoration till the end of the day if you had the choice.
Yeah.
But there's a difference between, okay, I'm kind of in a rush here. Everything's pulling at me. I can't really focus. I'm just trying to get this job done, versus, all right, you're my only concern right now until this job is complete. It's the best of my ability. I've vetted every material for biocompatibility, least toxicity, best results, processes and techniques with using ozone and laser that take longer. And if you're under the pressure of having to crank out so many insurance-based procedures per hour, you just can't do it.
I agree.
I mean, dentists try, and I feel bad for dentists that are really stuck in that model. Sometimes, if maybe some people do well with it, but for me, it just sounds like torture.
It is, and I've done both, and I can say it does eat at your soul.
Yeah, I bet.
That's why I sold my first practice.
Oh, okay, that's awesome.
It definitely, you have to, and you're right, in order to have any kind of viable business, you've got to play the game. And playing the game feels icky, even if you're doing everything. Like, I didn't break any rules, or there was no kind of insurance fraud. I was playing by their rules, but you've got to play by their rules.
Right.
So that means in order to have any kind of sustainability, which I barely had, because I'm not just super speed demon dentist.
Right.
It was okay. Well, I've got a nickel and dime thing. So if I can charge extra for a pulp cap or charge extra for the fluoride I was slapping on teeth back in those days, and you better believe I was placing a sealant on every empty groove that I could find in somebody's mouth.
I know. Well, bless you for admitting that. And it's not like you were doing anything bad.
No,
but it was
no.
what your mindset had to be in order to stay viable.
In order to survive.
Yeah.
Yes. And that was, looking back now, I'm glad for my patients that I'm not playing that game anymore.
Yes.
And what's interesting too, and I definitely sympathize with patients who say that they just have to use somebody in network.
Right.
I get it. But when I go in and I study my numbers and look at my revenue per family or revenue per patient, my goal for everybody, and what we usually can do is you might spend more your first year with me as we're kind of getting things healthy and getting things reset. But usually we're able to save patients money in the long run because they're needing less intervention. And that's the goal, is I want you healthy so that you need me less.
Exactly.
And then we just come in and we have fun visits and we can chill and have coffee in the back sometime.
Right.
And you don't have to sit and have your mouth open in a vulnerable position any longer than necessary.
Well, and there's something to be said for having the time to do restorative dentistry well the first time.
Yes.
And
so that you don't need redos. Yeah.
And I don't know if this has become a high priority for you, but to me, minimally invasive care has spared a lot of the sequela that go with more aggressive restoration. I do a lot more direct restorations with composite through a whole nother track of study that I've endeavored so that I can avoid excessive grinding of the periphery of the tooth for crowns and things. I do way less crowns than I used to because we know the statistics, I can't cite them, but so many root canal treated teeth are the ones that ended up finally with crowns.
Oh yeah.
So if I can avoid, so then if we can save the vitality of a tooth, minimally restore it, but give it the strength it needs so that you can get a lot of years of service without having it go down this whole sequela of root canals, failed root canals, extraction, implants. You're right. In the end, it saves the patient time, energy, money, pain, suffering.
Yes, for sure.
But to do filling that is of that level is not something that I could do under insurance reimbursement.
No,
there's
all. No way.
So
there's no
that's
way.
where I had to really diverge and
Unless
make
you
a
can
decision. Like
crank one out in 15 minutes and move on to the next one. Yeah.
Yep.
For sure. So what do you think would be the biggest thing that our colleagues get wrong?
It's not even dental. It's more on a self-knowledge side. That another whole side of my development as a professional was on the side of values clarification. Who am I as a person? What am I trying to bring forth in my professional endeavor? What do I want to be to the world of dentistry, even if it's not on a big scale? What do I want to be for my patients? How do I want to interface with the public as a person and as a professional? So I get it. When you're just out of school, those are things that it's kind of like, okay, when do you start saving for retirement? When do you start thinking about meaning in life versus survival versus, we have stages of life. But my recommendation to our colleagues, especially our young ones, would be as soon as you can posture yourself in a position where you have some time to work on yourself, to clarify your priorities and values as a person and as a dentist, then you can start setting your educational track towards what's most important to you. And for me, like it sounds like you have, that led to a whole different way of practicing. But even if you don't change it that much, or maybe you just kind of minimize the problems by only practicing 2 or 3 days a week, so you can have the rest of your life beyond that. And but I think not really being clear who they are and why they are in this profession is probably the biggest mistake that I've seen with our colleagues.
Absolutely. Absolutely. That leads to burnout and
Right.
dentists who create trauma in their patients.
Because they're having trauma themselves.
Yes,
And
for sure.
to acknowledge it is it's a very stressful type of job. We are doing microsurgery. Our expectations are extremely high on us. And we're an emotionally charged environment. We're also, many of us, trying to own and operate a business. We're trying to navigate employees and HR and the insurance needed for the practice, not the dental insurance, but all those things. Have a viable business model. Have, like you mentioned, you're looking at your financials. I think most of medicine, except for functional medicine providers that get away from the insurance model, most physicians aren't owning businesses anymore.
Right.
And they're a cog in a wheel of a big, huge organization. And I don't know if that's good or bad at the end of the day, but for dentistry, typically we are in private care practices.
Yeah.
Dentists can go into a corporate setting, but I've seen so much burnout on that because, again, they have another whole layer of lack of control over their decisions, their outcomes, but yet they still hold all the responsibility for the outcomes.
Yeah.
Which is
and liability.
A liability, exactly. And
Yes.
so it's, in a way, if I hadn't figured out that I needed to slow down, develop some more advanced skills in communication, develop some more advanced clinical skills, I don't think I could still be a dentist.
Right.
I don't think I would have made it.
Yeah. Well, I love that. As we close up, what would be the one thing that you would hope potential patients, would you hope that the general public would take away and would know about dentistry or oral health?
Oral health it really is, our mouth is the window to the body. It's so intricately intertwined with how we feel about ourselves, with how we function, with this extremely important part of our physique. It's the source of intake of nutrition and breath. It's how we express ourselves to the public with our mouth and our smile. It warrants the best care you can summon for yourself, and finding a provider that you can feel comfortable with so that you can go at your own pace and make progress that you feel good about. Don't stop looking if you haven't found that, and keep making it a priority, because it is going to have big benefits for all these different areas of your health as we go through life.
Love it. Love it. Love it. Well, I'm so glad that we got to have this conversation today.
Me too.
This was a treat, and we could talk for hours more. We'll have to do it again sometime soon.
Maybe we will. I'm sure that you're going to be thinking about new topics that come up. And, it'd be kind of nice sometimes to just have a platform to banter a little bit with other colleagues who are really trying to digest all the new things that keep coming up. So I would love to talk again sometime.
Oh, I love that. How can people find you?
So, pretty much across the board, the website, Instagram, and everything is just going to be my name, Dr. Sharon Dickerson. And that's where you find us.
Love it. Well, thank you so much. And everybody, thank you for joining. We will see you again soon on the Flourish Podcast. Thanks, everybody.
Thanks, Dr.
Bye
Engram.
for now.